Good evening, everyone. We begin tonight with President Obama on the defensive. Speaking from Boston, the president tried to drum up support for his troubled health care program. He chose to stand in Faneuil Hall, where Massachusetts' health care plan was signed into law 7 years ago and is considered a successful template for the president's own Affordable Care Act. He admitted to problems with his health care website and that people are getting cancellation notices. But he said giving people health care should be a no-brainer, shifting blame for canceled policies on private insurance companies.
Nobody's losing their right to health care coverage. And no insurance company will ever be able to deny you coverage or drop you as a customer altogether. Those days are over. And that's the truth. That is the truth.
Well, despite the rocky start to the health care marketplace, President Obama assured the crowd, quote, "We are going to see this through."
Well, seeing it through is what the president had in mind today, but it was very different on Capitol Hill. Grilled and drilled. That's what happened up there today as members of the House Energy and Commerce Committee grilled Health and Human Services Secretary Kathleen Sebelius over the bedeviled rollout of the healthcare.gov website. The drilling was over administration claims that insured people would get to keep their present plans, basically no matter what. Trouble is, many carriers are canceling low-cost, low-coverage plans because they don't comply with new, tougher insurance standards under the law. Bertha Coombs has more on today's contentious hearing.
Health Secretary Kathleen Sebelius seemed prepared for tough questioning, starting off with an apology to Americans for the rocky rollout of healthcare.gov, the problem-plagued federal site, which was down again today.
You deserve better. I apologize. I'm accountable to you for fixing these problems, and I'm committed to earning your confidence back.
Republican members pressed Sebelius about health officials' late changes to the system design and the lack of proper testing, which last week contractors told the committee contributed to the site's malfunctioning.
No one indicated that this could possibly go this wrong. I was always advised that there is always a risk with a new product and a new site, but never suggested that we delay the launch of October 1st, nor did our contracting partners ever suggest that to us.
A number of members held up letters from constituents whose plans had been canceled in the individual market. Sebelius insisted the administration did not mislead Americans when the president said that they could keep their plans.
Plans change so
dramatically
every year over time that the estimate was they wouldn't be, not because of our rules, but because of insurance companies' business decisions.
Well, but you set up what those market rules looked like they had to comply with, correct?
Only if they chose not to grandfather the policy. That's the start.
But that meant they couldn't
any
make any
grandfathered
change.
policy stayed in place still would be in place.
Right, but if
none
they
of these rules apply.
But if they made any change.
No, they could make changes in pricing. They could make changes in benefits.
And after saying for weeks that the health department was not going to release enrollment data prematurely, today the secretary explained why.
That data out there exists. And
Sir, I would tell you right now,
now
it is not reliable data. According to the insurance companies who are eager to have customers, they are not getting reliable data all the way through the system.
Even as another outage involving Verizon's Terramark unit hobbled healthcare.gov for much of the day today, Secretary Sebelius says she is confident that the website will be up and fully up to speed by November 30th, in time for people who want to enroll for coverage starting on January 1st. Bertha Coombs, Nightly Business Report, Washington.